to this very special episode of News Mobile, by the way. A very, very relevant question nowadays, especially at a time when all of us yet again are in the midst of a COVID surge. Let me give you some facts here to put the whole thing straight. With more than 2 lakh cases in the last 24 hours, India is at a critical crossroad. The path ahead is rocky, yet with the right approach, medical assistance, vaccination, and the urge to want to follow social distancing norms, we can cross the borders together. Let me give you some facts yet again. Apart from the 2 lakh that we spoke about, Delhi, the national capital, registered the highest single day spike of 17,282 fresh COVID 19 infections and 104 related deaths. India also reported 1,038 fresh COVID related deaths in the last 24 hours, taking the total death toll to 1,73,123. We are currently the second worst hit country in the world in terms of the total COVID 19 cases. Non availability of hospital beds, scarce supply of oxygen cylinders, and vaccination drives that are being halted due to shortage of vaccines are pouring in from different parts of the country. Obviously, the questions will emerge. What are these new symptoms? What are the precautions that we have to take? And what is going to be the future course of action? It is in this second wave that we are suddenly seeing a whole lot of numbers coming in the younger generation, especially children, which till this point of time was almost like an area we thought is not getting effective. What are your thoughts on it, and why do you think this is happening at the moment? Dr. Manan.
Yeah, apart from the mutant strains and the new strains that we have been talking about, one is that children have been doing outdoor activities more in the past few months than compared to earlier. Secondly, I think the testing has also gone up very significantly. Now, I'm talking of a very practical issue compared to last year, when the test could be done only if it was prescribed by a registered medical practitioner. Vis-a-vis gradually, we reached a situation wherein anybody can get the test done anytime, and the number of labs doing the testing has also increased. The hesitancy of doing the test has significantly come down. Now, I do about 3 to 4 video calls every day, wherein the whole family has tested positive. They tell me, okay, we have done it for the kid also. The kid is also positive. What to do? When I say, does the kid have any symptoms? He's mostly okay. Mild symptoms are there. Mild cough is there. So on the brighter side, kids still have symptoms which are less severe, or they are less symptomatic than the adult ones.
Also been seeing the kind of cases that are coming in. Now, these are, double mutant variants that are coming in. How do you see this in the entire picture in terms of, is it because of these mutant variants, these strains, that our numbers have drastically gone up? We're talking about 2 lakh plus here. Or you think it is because of the precautions that are not being taken at the moment?
In spite of clearly visualizing the second wave getting up everywhere in the world, when we were coming down from our first wave in November and December, we actually saw USA, then UK, then the entire Europe getting into the grip of the second wave. And we had the learnings from the last century when we knew that the Spanish flu's second wave was much deadlier and much more widespread. But I think we just behaved like pigeons in front of cats, and we thought that if we close our eyes to everything, it will go away on its own. But of course it won't. And the virus has really hit us badly now. We've had many variants of concern. I think at this moment, at least 7 variants of concern are floating around in India. We have the UK variant, the California variant, the Brazilian variant, the South African variant, and our own double mutant. And the risky part is the N440K, the double mutant, has the immune escape properties. So it can reinfect you. It can infect vaccinated individuals as well. So it is quite scary.
WHO Director General today itself, he has said today, Dr. Tedros Adhanom has said today that there is still a shocking disparity in global distribution of COVID-19 vaccines. So do you think that lack of vaccines is actually maybe leading to a community transfer issue, which is becoming a grave problem in the time that we are in right now?
In the recent past, we had a massive vaccination drive, and we all must understand that India is such a large and hugely populous country. And the government and the medical professionals, everybody tried their best, but we have definitely fallen short of whatever that was desired. Having said that, lack of vaccination is not the only cause which has led to sudden surge of the infection, because as Dr. Bajaj and Dr. Manan also said that there have been various mutant strains which have been detected, and now the virus has come with more power, and there are certain mutations which has rendered the virus more effective in attacking the host cells. We have maintaining social distance, and now look at all the political rallies and all the various social events that are happening. So
Right.
vaccination is just one part, an essential part. But then if we forget our other social measures and other things that we should take care of, then definitely we are going to witness even more surge.
There is this whole myth, and we've been seeing a lot of people coming back, a lot of cases where people have got vaccinated, but when they get their antibodies test done, the antibodies have not developed. How do you view this situation? And because the questions that people are asking is, in what was the use of getting vaccinated?
Vaccines, they have a certain percentage of efficacies. Now, most of the vaccines will be effective above 50%. Some of them will be 70% plus effective. Some of them will be 80%. Some of them 90%. Now, your intention in actually getting a large portion of the population vaccinated is to achieve a certain degree of herd immunity. A good herd immunity would be about 70% of the population having a significant amount of immunity against the what you call microbe that you are vaccinating against. So you factor all these things within that, and if a particular vaccine is say 80% effective, then 20% of those individuals will not develop those antibodies, and will, if you test them for vaccine efficiency, you will see that that efficiency of the vaccine has not been expressed in that particular individual. But it's part and parcel of the larger picture of what we are trying to do. That doesn't mean you don't get those individuals, what you call, you avoid vaccinating them. You have to get them vaccinated. And if some of them will not show the antibodies. And that's part and parcel of the game. But there is another component also. In India, especially, where you have a large malnourished population. So to develop the antibodies, you need to have good nutrition. Even those people who are surviving from the corona, what you call infection by the virus itself, those people who are well nourished will have good antibodies, they will have a good immune system. So one of the components of vaccine failure is also undernutrition or malnutrition, and that's especially relevant here in India also. And it's a vicious cycle. So if those who are malnourished, you get them vaccinated, some of them develop antibodies and they survive the disease, and then they go on to what you call developing a good and healthy life. Some of them do not develop the target what you call antibodies, and the vaccine is wasted on them, even though they do have the potential immunogenic what you call components within the system to develop the immunity, but you didn't add on the adequate nutrition components to complete the entire picture. So it's a part and parcel of a whole picture. Given these individuals who don't develop antibodies, the vaccination program should go ahead. And I just want to point out that we've achieved close to about say 11 crore vaccination shots. That's not 11 crore people, because many of them have been given their second dose also. So in a population of about 130 crores, if we are targeting a herd immunity of more than or close to around 70%, then we within the first wave and the second wave should have achieved a greater what you call number of people covered under the vaccination program. So we are a bit off the what you call hook on that.
Right. So, Dr. Manan, we were talking about children here, and how they are getting affected so much, large numbers. So, what is it, a lot of parents ask us, what is it that they can do? How is there some sort of natural immunity that they can build up in children? Because they also have that, they have higher chances of building up immunity. Is there something that can be done to safeguard children at a time that we are experiencing at the moment?
This is something, I tell parents, something which should be done at all times. We don't
Right,
need to do something good for our children just because we are in the middle of a pandemic.
right.
A good diet, if you pick up about 10 parents, 10 children in the city of Gurgaon, and you ask them what kind of diet the child eats, at least 50% will tell you that sabji nahi khata. It doesn't take vegetables. And in the name of vegetables, they eat potatoes. Remaining 50% would be taking cold drinks and junk food. A healthy diet is very important. A lot of green vegetables, a lot of fruits, a lot of fluids. Carbohydrate is to green vegetables is to food should be in a ratio of 1 is to 1 is to 1. That's the kind of food which child should take. Along with this, exercise is very important. If you lock your child inside a room,
Right.
that's not going to help. So he should go out, he should play. The screen time has to be reduced. The play time has to be increased. The exercise has to be increased. These
How do we, in the complex situation that we are in right now with mutant strains, etc., and the numbers rising and this whole complexity of things, when they pass it on to people who could have other issues, like diabetes or blood pressure or any other situation of comorbidity, what do they do? What do people like that do?
So, see, we have to understand that young children, asymptomatic adults, vaccinated people, anybody can catch the disease, be very mildly symptomatic or close to asymptomatic, and spread the disease around. And the ones who are unlucky enough to have comorbidities or are elderly or have had some previous issues will be the ones who will suffer the worst part of it. So we need to really educate the community on COVID safe behavior, tell them to keep practicing SMS as in social distancing, masks and sanitizations till we achieve herd immunity, which seeing the current wave of mutant variations coming in, I feel is a long way away. So we need to learn to live with this and practice COVID safe behavior for a very long time, which I think we as Indians have been doing for the past many decades, almost hundreds of years, but we've just lost it with the Western influence coming in. But our behavior has always been, we take our shoes off before entering the house, we wash our hands, we have a bath thrice a day, we don't hug or, shake hands, we just do namaskar. So we've had this behavior for a very long time. I don't know if it was influenced by last century Spanish flu or we've been always like this. But I think we need to go back to the basics and educate the community that this is the kind of behavior that needs to be practiced. And there is no compromise. As Dr. Manish Manan also said, the tests are easily available now. They are very cheap compared to what they were last year. I think the prices are less than 20% of what they started out as, and they're very easily available to everybody. So test. I think that is most important.
Right.
Just test yourself, even if you have the slightest doubt, and isolate yourself so that you do not spread it to others. Try and do self isolation, even for the mildest of symptoms. And unless you test negative, you should not be mingling around. And in any case, I think just this is the worst time of the disease. I think the next month is going to be very critical in determining which way we are going. So the next month, I think we should all try to go out only when most critical, just to earn our livings. Otherwise, every other thing which can be done from home should
Right.
be done from home.
So, Doctor, my point is, what is still missing? Why are we still out there? Why are people, and we're talking about educated people here who are meeting people, who are meeting family beyond family. We've seen enough videos and visuals of rallies and melas and kumbhs, of course, an example which is there stuck in our face. Where and what is it that we, as the normal, as public, what is it that we're missing? Dr. Halil.
The primary, what you call, mover in this case has to be the government. Now, we've seen nothing coming from the government. either the central government or the state government, which is telling us that we are in the midst of a second wave. In fact, quote unquote, we've got no official declaration or assessment that we are in the second wave. I think so. The people of India will be influenced once the government takes a very strong stand on this and comes out with clarity that we are in the midst of a second wave, and this is what we need to do to overcome it.
Dr. Shikha, how is the situation right now in, there are a lot of people who also come back to us and tell that once we have to go, there's also a lot of scare in people to go and get admitted in hospitals. As much as it might sound weird, because when you go to the hospital, you are getting better treatment. But the whole thing about getting into an intensive care unit and with the kind of death rates that we've been seeing is also very scary for people. They don't want to get to that kind of situation. How do we tackle that part of it?
The key is to get tested early and know that for a fact that you have this disease. Uh, and whenever your symptoms exacerbate, you have to take help of the hospital and get yourself admitted and as per the advice of the physicians. So there is no point in being afraid.
So there is a lot of vaccine fast tracks happening, but do you really think that India's vaccine fast track program, the way it is right now, do you really think it can help fight this deadly second wave that we are in? Anybody?
Have we really, fallen behind? And is it the right time for this mass vaccination drive per se, when we are in the midst of a horrible second peak?
Your your statement was deadly, more deadly second wave. So I just want to quote some data. The maximum number of cases which we saw in the first wave was about 92,500 or something in the month of September, and the number of deaths correlating with that was about 1,200 to 1,300 per day. And today, at a figure of 2 lakh, we have a death rate of about 1,036. So one thing I want to tell you that in the hospitals and amongst the doctors, they now know how to manage a critical patient of COVID. I'm sure Dr. Shikha, she is an intensivist, she knows much better. So as our intensivists in our hospital, they say that a very sick patient coming to the ICU, and within 3 to 4 days, they are able to bring the patient out from BiPAP to up to 2 liters of oxygen. I think the management of critical patient has improved significantly. There is no doubt about it that vaccination is going to help, because from whatever they're saying, it decreases the morbidity and mortality. We don't have a choice that do something else. So I mean, it's my take is that we should vaccinate as much as possible. And one one point I want to make, like Dr. Bajaj said, a lot of testing. He's absolutely right what he said. But what we have been noticing of late is that the labs are so overstressed. A report which we used to get in 24 hours, it's taking more than 72 hours. So what I'm now doing is that if your child is having cough and fever, it's not necessary to test on the first day. You presume that he's positive and isolate him. If you have some symptoms wherein if your report makes me make a decision on whether I need to intervene in you or some intervention is going to help you, then we do the test. If everybody comes to the lab to do the test, they are having a horrible time. They work 24 hours a day, and yet we are not able to get a report in 72 hours. And it's with most of the labs. I'm talking about Delhi and Gurgaon. I don't know what is the situation in Kanpur, but here, everybody, if somebody sneezes, he goes and gets a test done. Somebody has got a fever of 99, he gets a test done. I think they're overdoing it to a certain extent.
That's true. It is also being seen that even if the RT-PCR report has come out negative, it is no longer a guarantee that one is COVID negative. Now, how do we look at it?
I think the fact that the virus has mutated enough to escape the RT-PCR as well, we are getting in our hospitals as well a lot of patients who have clear-cut symptoms, who have CT scan findings, and who have repeated RT-PCR negatives coming in. So that is, I think, the capability of the virus to protect itself, to escape detection, to escape treatment, the immune escape as well. There is until we have a better test, I don't think we have a choice.
Absolutely. I think that's very, very important. One last question, Dr. Halim. You've been a COVID warrior. You've had COVID. Post recovery, any 2 or 3 things that you think people should keep in mind especially people who are recovering and who are in isolation and quarantine at home?
Important that to note that the lungs are the primary focus of this disease, and my lungs were severely affected. From that experience, the chest physiotherapy and ensuring that my lung capacity recovers significantly depends on continuing this chest physiotherapy post COVID. Second is that once you've had COVID, we've had in what you call on record a couple of people getting reinfected, which was
Right.
peculiar. And you need to continue with the basic precautions that you must wear your mask, you must wash your hands, you must what you call maintain physical distancing. And these are important what you call markers for a post-COVID survivor. Having said that, somebody who survived COVID, I think so, it somehow becomes an obligation and responsibility to come out and donate plasma also. Even though how effective plasma therapy is under the scanner, but at the moment these are the what you call modalities through which we can actually what you call help patients or try to help patient in this scenario. And vaccination definitely is something, but that should be titrated against the antibody level post COVID, because if your antibodies are still high and you take a vaccine, that vaccine will not be able to induce the immunity that one expects post a vaccination jab. So I think so a little bit of testing needs to be done. Once the antibody levels are down post COVID, then one should be comfortable and should go ahead and take a vaccination.
Thank you so much. I think first of all, before I say anything, even though I'm anchoring this thing, it gives so much of motivation to know that we have, doctors, the entire community who's selflessly been out there for more than a year now. We saw it all begin last March. We are already in April now. You've all been out there, and I think each one of us should take it upon ourselves to ensure that we take care of all the norms, we take care of social distancing so that we don't add a burden to all the doctors and all the work that they do. And I think that's one thing that we owe to you, all the public, to ensure that they can manage themselves in order to ensure that you all are doing your work. Thank you so much. This conversation has added so much of knowledge. It has given us so much of viewpoints that are really going to be helpful to all our readers. Thank you so much for being part of this special episode for News Mobile. Thank you.